Good evening. This video we will be discussing the respiratory system. As you guys can see, I created a model that would represent the respiratory system. Here at the top we have the trachea. This straw is representing the trachea. And then if you notice in the inside, there's two tubes, which is representative of the bronchi. And then if we look a little bit further down, we see the two balloons, which represents the lungs. And then here at the bottom, blue one here. This represents the diaphragm. So we will be looking at how the lungs work and how it works in conjunction with the diaphragm, with the rib cage, and the process of inhaling and exhaling, and what the lungs actually do. So yes, let's go ahead and start. So the first thing that we will be discussing is the process of inhaling. So when air comes in to our lungs through here, so we inhale, our lungs are going to expand. Our diaphragm is going to lower. Which is expanding, opening up the lungs. There's more space now. Diaphragm comes down. Lungs expand. If we talk about pressure, the air is going to go where there's more pressure. So we inhale, lungs open up, so now there's more pressure inside the lungs, so it's going to go inside of the lungs. Okay, and then, so now what happens when we exhale? We're pushing the air out. Okay, so inhaling, diaphragm was down, lungs expand, but now when we exhale, diaphragm goes up. You can see a little bit. The lungs are gonna relax, so they're gonna deflate. So the pressure is no longer inside of the lungs anymore. Now it's outside. So that's why the air was able to just leave the lungs. Pressure is more outside. Pressure inside now is less. Again, so the diaphragm is going to go up. Pressure is going to go out of the lungs. The lungs are going to relax. Air is going out. So, you might say, why do some people have a larger or smaller lung capacity than others? And the basic response to this would be that the human bodies, they're all made different. We have different sizes of chests. Our lungs might not all be the same size. Some of them are a little bit smaller, some of them are bigger. And the chest, like I said, the chest cavity, the size of the chest cavity, and also considering the diaphragm, how strong it is. So when you combine all those factors, that would be the reason why some people are able to, like we said, why some people were able to have more lung capacity than others. How does asthma affect the lungs? Well, it's the respiratory system is very important. Plays a huge part in carrying oxygen to all of our body. And when this is compromised, there's a problem. How does asthma affect the lungs? Well, what happens is that there's a swelling and narrowing of the airway, which leads to the oxygen going inside the lungs to be decreased. So how do people, or how does a medical facility, what are the clinical manifestations of swelling inside the airway? And you're gonna hear wheezing in the lungs when you listen to it with the stethoscope. There's a cough, a forced cough. There's dyspnea, tightening of the chest, and there's no treatment, there's no cure for asthma, but there are treatment options out there, which has to get treated. If left untreated, there is a complication that is called airway remodeling. So what happens is that the actual structure deviates or moves in a way to accommodate for the tightening of this airway that has affected the tubes or the bronchi. So very important, yes. When we talk about medication for asthma exacerbation, there are treatments that they give you. Some of them are bronchodilators, steroids, nebulizers, inhalers. That would be considered a medical emergency. Like I said, this helps carry oxygen to all of our vital organs. So, very important. Nursing interventions, when there's an asthma attack, definitely first and foremost, assessing the patient's respiratory status, their breathing sounds, documenting all findings, and making sure that the patient is receiving the adequate oxygen needed. Giving oxygen and checking with the oximeter to check for his oxygen levels, making sure that he is doing fine. Again, the goal is to preserve airway patency. That's a priority. The nursing goal is to reduce the congestion and making the breathing sound clear. Education for this, educating a patient would be reminding them, you know, that medication is very important. Taking them when they're supposed to take them is essential. Also, educating the patient on how asthma attacks are triggered, and when the patient or the client is educated on that, he might know the signs and symptoms before it gets to a point where he is not able to do something to prevent a big asthma attack. Resources for people suffering from asthma attack. There's always a lot of companies. For instance, there's some local resources here in Arizona. One of them is called the Arizona Asthma Coalition and the Arizona Department of Health and Services. These organizations offer services for people that might need help with medications, financially, transportation issues, delivering to their homes. All that would be factors. And they also offer therapy and interactive learning. They want the patients to interact, to understand this disease. That way they'll be more prepared. So in conclusion, model, great idea, look great, gave me a visual picture of what the lungs actually do. Very interesting, complex, hard to understand how complex it is, but definitely great way of transporting oxygen to our vital organs. Very precise. I want to thank you for listening. Full of information, video, and hope to see you guys next time. Bye.